All right, good afternoon, everybody. I apologize for the delay. We have not had great luck with lunch this week, so we were unfortunately delayed. So we want to get back to our meeting. So next on our agenda is item number 21, which is the discussion and possible action regarding required display of license or registration, Business and Professions Code 4980.31, 4980.32, 4989.17, 4989.48, 4996.7, 4996.75. Okay, sorry. All right, et cetera. All right. So, learning curve for your university. All right. Roseanne.
Thanks, Chris.
Sure.
So in terms of the display of the license or registration, currently in law, well, right now, all licensees and registrants with the board receive a paper copy of their license and registration when they are issued their license or registration. And that paper copy contains the person's name, their license number, the type of license, and also their expiration date. And so the law requires that they display this license in a conspicuous place in their primary place of practice. That's the wording of the law. And this was likely written in a way to ensure that a client, when they went into their therapist's office, that they could actually see that their therapist had a license or registration and the licensing information when they were there for an appointment. However, with the increased use of telehealth, things have kind of changed. And so there's a question of whether the law needs updating. Some therapists' primary place of practice might be virtual, or they might be seeing clients over the telephone even. So it might make it difficult or impossible for the physical paper copy of the license or registration to be on display for the client to go over and look at it and get whatever information they need if they want to. In terms of other places in the law where this might be required, current law does not necessarily require all licensees or registrants to provide a license or registration number when they begin services with a client. With the exception of MFT Associates, they have a particular statute that requires this. But other licensees and registrants are only required to provide this information when they initiate telehealth services with clients. So right now, what the telehealth law says that when you initiate telehealth, you need to provide your license and registration number and type of license or registration. And also in advertising, all licenses or registrants are required to include their license or registration number in advertisements, but there is no across the board requirement for all types of therapy that this information actually has to be provided at the outset of services, other than the display in the office. So we've discussed what to do about this at a few different committee meetings. We talked about it initially, and we had looked in committee at drafting language to provide other options other than displaying if it was not possible due to services being provided to telehealth, for example, to tell them at the beginning of every therapy session what the license and registration number was. However, after we drafted this language, there was kind of some concern that providing this information at each session could become overly burdensome. So we kind of went back to the drawing board. And in July of 2023, the Policy and Advocacy Committee meeting asked staff to look into a solution that would incorporate providing the license or registration number, type, and expiration date in the required notice to clients that must be provided to a client prior to initiating psychotherapy services. And this is the notice that is required that licensees and registrants provide when they begin therapy, that basically says that the Board of Behavioral Sciences is their regulating board, and how to contact the board if they need to. So right now it just says I'm basically regulated by the Board of Behavioral Sciences. Here's their contact information. This particular proposal that we're proposing in attachment A today would also require that they provide their clients with their license and registration number. And so the language we're proposing today also includes language because if they have the expiration date in the notice and it's only given at the onset of therapy, obviously licenses might expire. So we included a clause or included language that says the therapist is responsible for notifying their client if there is any change to the active status of their license, in case that were to change. So attachment A shows the proposed amendments. It basically proposes deleting the requirement that the license or registration be displayed and instead provide that the information in the notice to clients at the outset of therapy that's given out include the license and registration number, type of license, and expiration date. So you can see that language in attachment A, and I will open it up for discussion.
Sorry, any comments from our board members? Kelly? Good, perfect. All right, any comments from public? Any comments from our remote public?
Thank you, Mr. Chair. I would encourage members of the public to raise their hand if they'd like to comment on this agenda item. You may click on the hand next to your name, or if you've called in, press *3. We'll give you a moment. This is the moderator. I see no request for comment. I return the floor back to you, Mr. Chair.
Excellent, thank you. Do we need a motion on this, Roseanne?
Would you like me to read a suggested one?
That would be fantastic.
So the motion would be to direct staff to make any, well, we didn't discuss any changes, so to direct staff to make any non-substantive changes to the language in attachment A and to pursue as a legislative proposal.
Mr. Chair, I'd like to make that motion, please.
Excellent. Do I have a second? I will second the motion.
Second. Second to the second. What?
All right. You have a second? Any further discussion? And from Ben, any further discussion from our online or our remote participants?
This is the moderator. I'm encouraging any public member that would like to make a comment to raise their hand if they'd like to. We'll give them a moment. All right, I see no request for comment. I return the floor back to you, Mr. Chair.
Thank you so much. Christina, would you take the vote?
Sure. And before I start the vote, I just want to mention that Eleanor Uribe left the meeting at 11 o'clock today, but we still have a quorum. I'll start the vote.
Thank you.
Kelly Ranasingi. Can you turn on your mic, Kelly?
Can't hear.
One more time. Okay, I'll come back to you. Dr. Annette Walker?
Yes.
Yvette Caceres Willis?
Yes.
Nick Boyd? Can I get your mic on?
Yes.
Thank you. Susan Friedman?
Yes.
Wendy Strack?
Yes.
Chris Jones?
Yes.
Justin Huft?
Yes.
Abigail Ortega?
Yes.
Roseanne, I'm sorry, not Roseanne. Kelly Ranasingi? We don't have audio and Kelly. can you
Kelly,
just
yeah.
Take a head nod.
Yes, that is
That's an affirmative.
that's an affirmative.
And we have, motion carries.
Thank you, Christina. The next item on the agenda, item number 22, is the discussion and possible action regarding clarifying the term supervisee. Roseanne?
Thanks again, Chris. So this is a suggestion that was brought to us by some of our stakeholders. And currently, the board's practice acts reference the term supervisee, but do not define it. And in most cases, that's probably fine. A definition is sort of implied and not needed in the context that it's used in most cases. It can be reasonably inferred to mean an individual required by the board to be under supervision. An individual might be required by the board to be under supervision for numerous reasons. They might be an associate and they're gaining hours toward license, so it's required. If they're working in any non-exempt setting, then you have to have a registration, even if you aren't gaining hours. If you're working under the 90-day rule, you have to be under supervision. Or if you're an MFT trainee and you're counting hours toward licensure, you have to be under a supervision of a board approved supervisors. But there are two particular instances in law where that might not apply and the intended definition becomes unclear. And we get some questions about this. So clarification might be helpful. There's two different cases and they're both a little bit different. So I'm going to go over one first, open it up for discussion, and then I'm going to talk about the second one so that we don't get, so it doesn't get too confusing. So first, when we have in law the definition of direct supervisor contact, each of our practice acts, MFT, LPCC, and LCSW, each subsection has a definition of individual supervision, triadic supervision, and group supervision, and discusses what direct supervisor contact means. And so the current definition is for direct supervisor contact is one supervisor and a specified number of supervisees, 1 and 1 for individual, 1 and 2 for triadic, or 1 and up to 8 for group. And so with group supervision, it's 1 supervisor and up to 8 supervisees. The law does not address whether individuals receiving supervision who are not required by the board to be under supervision count as members of the group of the allowable 8. For example, a licensee or a pre-licensed psychologist might be participating in that group clinical supervision for various reasons, but these individuals do not fit the implied definition of a supervisee because they are not required by the board to be under supervision. So the specific question that was coming up was, we had an organization that was requiring some of their licensees for whatever reason to participate in this supervision. Maybe they felt that it would be helpful for them, that particular licensee. And so the question was, does that licensee count as one of the 8? The law doesn't really provide an answer to that. They're taking a spot in the supervision group, and it's likely limited to 8 in order to ensure that each group supervisee gets proper attention from the supervisor. So we were asked to consider clarifying. And so attachment A shows a proposed solution to that issue. Instead of limiting the number of supervisees, the language instead limits the number of persons receiving supervision for providing clinical mental health services. So that would capture not only the board's associate trainees, 90-day rule applicants, but it would also capture a psychology pre-licensee or just a regular licensee, say they're an LMFT, that are also doing clinical work and receiving supervision because their employer is requiring that. So that is attachment A, and I'm going to stop there and open it up for discussion before we move on.
I like the wording. I think that getting a term that brings everybody in, I think that makes the language much more simple and easier to understand. Any other comments from our board members?
Justin Huff, LMFT. Thank you. I do think that this clarifies it. I'm left still uncertain about who is captured under different supervision circumstances, though. If, for example, I am a clinical program director, I'm overseeing all therapists, all clinicians of different types of clinicians, including staff, and I provide some sort of supervision to them. Many of them, if they are licensed, or in fact, maybe none of them, are going to be required by the board to participate in supervision. But in internal documents, they would be under my supervision. Are they included under the 6?
It would be intended to be a group that's meeting once a week for the specific purpose of providing the kind of supervision that the board requires. So that once a week meeting for every 10 hours of therapy. That clinical supervision group, if you're licensed, if you have a licensee that you're requiring to do that, then that would count. If you're just, I'm supervising this and it's not clinical sort of training supervision, it's just my organization and I'm supervising, 10 licensees, sure. That's not what it's talking about now.
Okay, so then just to make sure I'm hearing you correctly, and that supervision circumstance where it's not for the Board of Behavioral Sciences, both in group and in individual supervision, these, despite the same term of supervision, would not be captured under this.
Right. Supervision is a defined term in our law, where a supervisor is a defined term and supervision is a defined term, and it's very specific tasks. You have to meet very certain specific requirements to be a supervisor, as the board's law defines it, being licensed 2 out of the past 5 years. do certain trainings. That is not the supervision that you would, it is kind of confusing. It's not the supervision that you would have just in an organization. I'm an MFT supervising other MFTs. Supervision is actually defined in the law, and it's certain tasks that's outlined that the supervisor has responsibilities for. It's that particular kind of supervision being referred to in the context of the law, not like a workplace supervision.
Understood. Thank you very much.
So Roseanne, just so I'm more clear, you're referring simply to the, not simply, but you're referring to the supervision of pre-licensees who are working towards licensure, not as a like managerial supervision, right? Okay.
Right, not a managerial supervision. And it is, I mean, most people, when they think of it, you know, when you think of a supervisor, you think about any workplace setting, but this is specifically for training, but we're finding that we're having people be required to attend those sessions. And usually they're once a week, especially if it's group, it's like once a week for a couple of hours. And they're for some reason requiring a licensee to be in there, or several, you know, licensees. And really that group is meant to be limited to 8 so that everybody gets the individual attention that they need. So that's where the concern comes up. It's like, well, you know, if there's just one in there, you know, that's probably okay. But what if people are requiring, you know, like 10 licensees to sit in and participate, have this supervision, and then it's kind of taking away from the associates. So that's kind of what we thought about going a little bit further. At one point, we had drafted some language saying who could be in the room participating, but then we didn't want to get that prescriptive, because then it can limit if they have brought somebody in like a specialist for a specific reason or something, then there's all kinds of scenarios that can come up that we can't necessarily address. So that's why we chose the language that is here today. Hopefully that makes sense.
Yeah, perfect. No, thank you. Any other comments from our board that's here? Kelly? No? All right. Ben? Ben's good. All right. How about from our remote participants?
Thank you, Mr. Chair. If any member of the public would like to comment, please raise your hand by clicking on the hand next to your name or pressing *3 if you've called in. We'll give you a moment. All right, I see no requests for comment at this time. I return the floor back to you, Mr. Chair.
All right, thank you. Roseanne?
I'm going to keep on going, and then we can do the motion at the end, if that works. So the next thing that I want to talk about, and it's kind of the same concept, but in a different scenario, in a different context, as another question is raised, there is a subsection there for each of the 3, LMFT, LPCC, and LCSW, that requires supervisors of supervisees in non-exempt settings to have no more than 6 individual or triadic supervisees at any one time. And I'm going to just put out at the front, in exempt settings, there's no limit on the total number of supervisees per individual or triadic supervisor. It's only in non-exempt settings. So we're talking about non-exempt settings. It goes on to state in the law that supervisees may be associates, basically associates of any of the 3 types of associates that we have. So the reason for this limitation on the number of supervisees in non-exempt settings is to ensure that a supervisor can dedicate enough time to properly supervise each one. And also to kind of, the reason it's limited to non-exempt settings is just that those are usually for-profit agencies. We don't, you know, there's always that balance of, you know, making sure that they're not just having a bunch of associates that they're training that are, you know, a little bit low cost or lower cost labor, that they're actually dedicated to making sure that these individuals learn and move through the process. So that's why it's limited to 6. However, stating that this only includes associate leaves out other potential types of supervisees, and I think that's unintended, such as trainees, those under the 90-day rule, or those seeking a license with the Board of Psychology. Staff believes that the intent of the law is likely to limit all types of supervisees to 6 in non-exempt settings. So attachment B shows clarifying language for this particular subdivision, and it does 2 different things. This is what we're trying to accomplish here. We want to clarify that supervisors in non-exempt settings are limited to a total of 6 individual or triadic supervisees. Currently, it's a little bit unclear whether it's 6 supervisees per setting or 6 total across all settings that are non-exempt. We get that question sometimes, so we tried to shore that up here a little bit, make it a little bit more clear. And then instead of saying it's limited to a total of 6 supervisees, we said that it's limited to a total of 6 individuals who are receiving supervision for providing clinical mental health services in non-exempt settings. So by using that language, it captures not just associates in the limit, but also other types of supervisees, trainees, social work interns, 90-day rule applicants, pre-licensed psychology individuals. So that is the proposal shown in attachment B. The Policy and Advocacy Committee considered this in July and directed staff to bring the language to the board for further discussion. We brought it to the August board meeting. The board gave staff the direction to draft the option in attachment B that you see today that would include all individuals providing mental health services in a non-exempt setting. We brought it back to P&A to review the language one more time in October. And they directed that it come back to board now for consideration as a legislative proposal. So that's where we are. So I'll open it up for discussion on attachment B, and then we can talk about the motion after that.
Justin.
Yeah, thank you, Justin Huff, LMFT. Again, thank you. I think this is very clear. I appreciate this language. I'm wondering if you can elaborate a little bit on how the board is capturing instances where supervisors have more than 6 supervisees. I know that this would not necessarily change the existing process, but can you help me understand what that is?
Do you mean more in terms of maybe they're working for an exempt setting and a non-exempt setting?
Yeah, so, or if we had a supervisor right now who has 20 supervisees, how would we know that?
We wouldn't really necessarily know that for sure until those people turned in hours, and then it might start to look a little bit suspicious if we started seeing all of these people that were that coming in being supervised by Joe Smith from, you know, Riverside. And then that might raise a red flag and might trigger an audit. If Joe Smith works in an exempt setting also, he is allowed to have as many supervisees as he wants. We would remind him that, you know, he has certain ethical and legal obligations as a supervisor to make sure that he is doing an adequate job of supervising. But in terms of, it's basically as many as you want in an exempt setting that you can responsibly supervise within the legal and ethical parameters. But in all non-exempt settings, you are limited to 6.
Great, thank you. And I know somewhere there's a Joe Smith supervisor who's feeling very nervous right now.
I picked the common name on purpose, so he
Yeah,
didn't feel singled out.
and so when you say we would have to recognize it. That is 1, 2 people who just happen to see the same supervision name over and over again. We're relying on that as the
Right, and they sign certain documentations at the outset
Okay.
of supervision, and when we redid our supervision regs, we tried to make it a lot clearer, and Christy did a great job of that in the supervisor documentation that I understand, and they now have to initial all of
Yeah.
the requirements. And so that's kind of a check, and so that people are aware of that, and they are signing that, you know, they understand the rules. And so, but we wouldn't, unless it was really brought to our attention, no, we would not necessarily no, but it's kind of one of those things where, you know, it's a little bit difficult to enforce.
Sure.
We would likely eventually find out if it was a problem.
And so again, I want to be clear that I know this is not, the language is not changing that, so I appreciate that. I do think that this is a good example of why, as Steve noted earlier, an online system for submission might be helpful, because some of what we're trying to address in language can also be helped by streamlining some of the process.
Yeah, and we have had, when we did our supervision committee several years ago, we had a long discussion about, you know, how do we track supervisors and know exactly, and you know, we're kind of doing a start now with the supervisor forms. We're starting to sort of register who is a supervisor, so we know more of that now, but there's kind of a legal issue with making that public. Not everybody, you know, that requires permission, because not everybody may want everybody to know that they're a supervisor so that they get kind of inundated with requests. So there's some, we're hoping as time goes on and Breeze becomes more streamlined, is that the word, Steve? That we're able to do more.
Yeah, and I think that's kind of been it was a great start to do the supervisor self-assessments. It's kind of, there was a start where you're talking about through the supervision committee. But I mean, and looking down the road, supervision is a big topic right now in national conversations, kind of how do we make sure people are getting good supervision? And so with utilizing Breeze, and like you said, if we're able to do something electronically, we'll have more tools to actually kind of review, supervision. So, and I think that's our goal, is to kind of, move in that direction.
Great, thank you both.
Nick, Nick Boyd, LPCC. So I think it's pretty clear, just like Justin said, and I mean, I think most people can understand the interpretation of that and to be pretty cut and dry. However, I'm also thinking about those that might not, and I wonder if there could be some type of language to include regardless of organization, or something to make it even more specific that it doesn't matter where these individuals are coming from, but that it's one supervisor. Doesn't have to be in one institution. So I think there might be just potentially some opportunity for that to breed ambiguous for some individuals, to not be clear that that doesn't matter which organization they're coming from. Does that make sense? Kind of, because I think the way that it's written, if I understand correctly, individuals who are receiving supervision for providing mental health in a non-exempt setting. So by changing the word individuals, I think the assumption is that it's individuals, but I guess what I'm saying is, could a supervisor look at that and say, just individuals in this exempt setting, or is it individuals across multiple exempt settings? Does that make sense? So I think that's where I'm saying that potentially could be misinterpreted. I wonder if there's a way to just make that a little bit more clear in that regard.
It says supervisors in non-exempt settings shall not serve for more than a total. I mean, I think that captures it probably as clearly as we can, but I think that when we're doing our supervision forms, we can make sure that we have an FAQ question to sort of clarify that, because it is a question that comes up occasionally. I think this takes a step toward improving it, but the way that we write it in the law, we have to be sort of careful. We can't necessarily, we have to use the term non-exempt setting because that's defined legally. When we start naming, like in any setting, that has different meanings in the law than it does in plain, I don't want to say in plain English, but in plain English. So I think that's something we can address through our FAQs. I think it's probably as clear as we can get it in law, unless anybody has any brilliant suggestions beyond what's come up. But I think that's an FAQ type thing.
Or even the supervisor self-assessment form.
Yeah, and on
we
the
do-
supervisor self-assessment, we can address it there as well.
Yeah, thank you.
All right, any other discussion? All right, Kelly? Okay, Roseanne, would you, do you need a motion on this?
So, yes, do you want to do a motion and then do public comment?
Yes.
Okay, so the motion would be to direct staff to make any non-substantive changes to the proposed amendments shown in attachment A and B, and to pursue as a legislative proposal.
Do I hear?
I'll make that motion.
Thank you, Kelly. Do I have a second?
Second, Justin.
All right, thank you. All right. Ben?
Thank you, Ben Caldwell, MFT. This is not a suggestion for a change, but just a comment to get on the record with this discussion. It came up in committee, concern that some folks had expressed about people who are pursuing a certification in a particular therapy model. And the process of certification requires them to get supervision within that model, even though they're already licensed. In the committee, the discussion, as I recall, basically landed at that wouldn't be considered supervision for a licensure purpose. And so this is not intending to capture that or count those individuals as supervisees. If I'm remembering that correctly, I wanted that included as part of the discussion, but it's not a recommended change to the language.
Right, it's kind of like along the lines of Justin, it would be a different type of supervision. We are talking about the type of supervision for individuals that's typically used for individuals pursuing licensure and anybody that may be required to also sit in on that for other reasons above and beyond pursuing their 3,000 hours.
Great, thank you.
All right, thank you, Ben. Are there any comments from our remote audience?
Thank you, Mr. Chair. If any member of the public would like to comment, please raise your hand by either clicking next to your name, or if you've called in, pressing *3. We'll give you a moment. All right, this is the moderator. I see no request for comment. Mr. Chair, I return the floor back to you.
All right, thank you, Tricia. Any further comments from the board? All right, Christina, we're ready to take the vote.
Yes, I was getting another repeat on the motion.
All right,
Okay, Abigail Ortega,
Yes.
Justin Huff,
Yes.
Chris Jones,
yes.
Wendy Strack,
Yes.
Susan Friedman,
Yes.
Nick Boyd,
Yes.
Yvette Caceres Willis.
Yes.
Dr. Annette Walker.
Yes.
Kelly Ronasinghe.
Yes.
Motion carries.
All right, thank you, Christina. Next is item 23 on the agenda, excuse me, discussion and possible action regarding proposed amendments to the Business and Professions Code, amend BPC 4980.54, acceptable sources of continuing education for licensed marriage and family therapists. Roseanne, back to you.
Yeah, so this is what I was talking about early when I referred to the omnibus bill. So every year we review our statutes, take staff and stakeholder feedback to see if there's any technical, minor, or non-substantive adjustments that need amendments in the law. So, and typically these are not items that are big enough to justify their own bill. And so they are placed in something that the Senate Business and Professions Committee runs each year that they refer to as the committee bill, or also known as the omnibus bill. And so we've identified one amendment that the board may wish to consider for this year, and that is Business and Professions Code Section 4980.54F. And that is in the MFT Practice Act, and it has to do with acceptable sources of continuing education for LMFTs. And so in terms of a little bit of background, this particular section specifies CE requirements for LMFTs and states that CE must be obtained either from a CE provider accepted by the board as specified in regulations, or from an accredited or school or state approved school that meets the requirements in Business and Professions Code sections 4980.36 or 4980.37. So by mentioning 4980.36 and 37, those are the two really big sections in MFT law that contain all of the requirements, basically almost all of the education requirements to qualify for LMFT licensure. So while referencing these sections for CE, the intent is to reference the fact that the schools must be accredited or approved. But by referencing this for CE, it kind of implies that any CE taken from a school, college, or university must be from an institution that is not only accredited or approved, but also offers a qualifying MFT degree, because those sections specify what a qualifying MFT degree is. That's not really the intent of what we're trying to do with the MFT CE. The intent is that the CE course would be from a school that's accredited or approved by a specified entity. And that's what's referenced in LCSW and LPCC law. It does not reference the education codes for a qualifying degree. So what as an alternative, Business and Professions Code section 4980.03I and J define accredited and approved schools for purposes of the MFT Practice Act. So I think that referencing this section rather than referencing 4980.36 and .37 clarifies the intent that CE courses must be from a school that is accredited or approved, but not necessarily one that offers a whole qualifying LMFT degree program. So this proposed amendment is shown in attachment A, and it makes the LMFT continuing education requirements more in line with what's already in law for LCSW CE and LPCC CE, which references the definition of accredited and approved, not the entire qualifying degree requirements. And so you'll see that change, as I said, in attachment A. We took this to the Policy and Advocacy Committee meeting at the end of October, and they recommended that the board consider the amendments as a legislative proposal. So here we are today, and I will open it up for discussion.
Any discussion from our board? No? Kelly?
I'm looking at, Roseanne, I'm looking at 4980.03, and it says any institutional accrediting agency that is recognized by the U.S. Department of Education. Is that too broad? And it may not be. I'm just asking you, Roseanne, because I know that the breadth of schools that can be institutionally accredited is pretty wide.
No, that is pretty standard language in terms of accredited. The accreditation agency needs, and then there's a whole thing you can go into on the USDE website of what accreditation is and the types of accreditation. That is accurate and appropriate. That's how we define accredited and approved for all of our practice acts, and so it's not something that's probably like, if we went more specific, it would be something like COAMPT or CACREP for LPCC, and that's too specific. A lot of schools can't.
Gotcha.
It's too expensive to meet those requirements necessarily. So we require it to be basically USDE approved as a regional or national institution. There's very specific definitions of that on their website, or the DCA has a state approval process for schools as well that's accepted.
Okay, sounds good. Thank you.
Okay, any further discussion? All right, Roseanne, would you draft a motion for us?
Yeah, so the motion would be to direct staff to make any non-substantive changes to the language in attachment A and to pursue as a legislative proposal.
Justin Huft, LMFT, I motion to direct staff to make any non-substantive changes and to pursue legislative proposal.
Do I have a second?
I'll second.
All right, thank you, Wendy. Any discussion from our audience? All right, any discussion from our online participants?
Thank you, Mr. Chair. If any member of the public would like to comment, please raise your hand by either clicking on the hand icon next to your name or pressing the *3 if you called in. Well, we are displaying instructions and we'll give you a moment. This is the moderator. I see no request for comment. I return the floor back to you, Mr. Chair.
Thank you, Tricia. Christina, would you take the vote?
Yes. Kelly Ronasinghe,
Yes.
Dr. Annette Walker,
Yes.
Yvette Caceres Willis,
Yes.
Nick Boyd,
Yes.
Susan Friedman,
Yes.
Chris Jones. Sorry, I'll get you.
Okay.
Yes.
Wendy Strack,
Yes.
Justin Huff,
Yes.
Abigail Ortega.
Yes.
Motion carries.
All right, thank you, Christina. Next on our agenda is item number 24, the Telehealth Committee update. Roseanne.
So the Telehealth Committee held its most recent meeting on June 8th. The purpose of the committee is to determine if any of the board's statutes and regulations related to the practice of telehealth by the board's licensees and registrants and trainees need to be updated and clarified. So we're kind of in the process of winding down the Telehealth Committee. It's done a lot of work. A lot of work was identified with telehealth. Telehealth has come a long way since 2020 when we had the COVID-19 state of emergency, and we found that there were many things that need to be addressed, and we have addressed a lot of different things. And so at the last committee meeting, the committee discussed the results of a board survey to gather information about the licensees and registrants' experiences working for online-only therapy platforms. And so what we did is we went back and we met with the Senate Assembly and Business and Professions Committee to discuss the survey results, and we're working on a draft letter or outreach to online-only therapy platforms and employees. And so we're going to be discussing that again at the next meeting. And then also at the last meeting, we discussed the current efforts in other states to develop an interstate compact for social workers and counselors. And the result of that was we're going to continue to monitor how these efforts are progressing. Over the past couple of years, the Telehealth Committee has been successful in making several law changes. Most recently, our temporary practice allowance for out-of-state licensees whose clients are visiting California, or AB 232, was recently signed by the governor and goes into effect on January 1st. We had AB 1758, which amends the law to permit supervision via video conferencing in all settings. Previously, it was only allowed in exempt settings. And we had AB 1759, which created a baseline requirement of 3 hours of training and coursework in the provision of mental health services via telehealth and law and ethics related to telehealth. And then also clarifications that certain pre-licensees can provide services with telehealth. So that was signed in 2022 via AB 1759. So that's sort of the progress that we've made in that committee. The next telehealth committee meeting is going to be held on December 15th.
All right, thank you, Roseanne. Any comments from our board? No? I would like to thank the hard work of our committee members. Oh, sorry, I didn't see.
I'm sorry,
I
just
apologize.
Dr. Annette Walker,
Yeah.
Public Board Member, just a quick follow-up. You said you're winding down. Are we looking at not holding this committee anytime soon, or what does that mean?
It means that it's kind of coming to the end of its identified tasks to discuss. It doesn't mean that we won't be talking about telehealth anymore. It just means that a lot of the proposals have been discussed and will be moving on through policy and advocacy. And so, yeah, a lot of the big things have been tackled, but there will be more. We will be more in the future for sure.
Yeah, I think our final meeting will be in December. Yeah, until the bat signal comes up again and they need us to come to the call. So like I was saying, I do want to thank Susan Freeman and Kelly Rossini, and of course Roseanne and the BBS staff. We worked really hard for a long time. Yes. Oh, thank you. Yes. All right. No, we did a lot of work in a short amount of time, and it was very interesting.
A learning experience.
It was a really interesting committee, really fun to participate in. So we're looking forward to wrapping that up in December. Do we have any comments from public? How about from our remote participants?
Thank you, Mr. Chair. If any member of the public would like to comment, please raise your hand. We are displaying instructions. All right, this is the moderator. I see no requests for comment. I return the floor back to you, Mr. Chair.
All right, thank you so much. Next on the agenda is the licensing committee update. Roseanne? Oh,
Thanks.
sorry, is Steve. I apologize. Is it Steve or Roseanne?
Oh, I can take it unless you can. Either way, I'll do it. So the licensing committee, which we are now going to be changing the name, which I'll talk about that in a minute. It last met on the end of October. And the board originally formed the licensing committee to conduct an in-depth discussion about several topics related to the licensing process. And we've had this committee for a while now. It has conducted an in-depth discussion about topics related to licensing, but we're sort of shifting the gears a little bit on what this, where this committee is going. It's been discussing short and long-term goals for the board's workforce development action plan. And that action plan includes a short-term goal of reviewing current licensing pathways to identify where there might be any unnecessary barriers that might exist in the licensing process. And then the long-term goal after identifying these is to work toward developing solutions to reduce those identified barriers. So because this is kind of the expected direction of what this committee is going to be working toward, at its October meeting, the committee voted to change the committee name to the Workforce Development Committee. And so also items discussed during the October meeting, we discussed a draft of a consumer outreach document designed to explain the board's regulated professions to the public. We heard a presentation by DCA's Office of Professional Exam Services on the purpose and validity of professional licensing exams. We discussed a voluntary demographic survey for candidates taking board developed exams. And we heard a presentation on barriers to licensure and suggested solutions by the California Alliance of Child and Family Services. And so we'll be continuing our discussion of barriers to licensure and some of these topics at the newly renamed Workforce Development Committee. And that's going to, the next one is going to be held on January 19th.
All right, thank you. Any comments from the board? Dr. Walker?
Just a question, given what we know now and about our meetings, meeting in person, meeting via teleconference and things like that, what are we planning to do moving forward here? Because I think our last meeting was online.
With this, since this is a advisory committee, it can be online still. So we're going to continue committee meetings online. So
Okay. Now, does that move beyond the December 31st,
yes,
2023? Oh, we can continue on.
that was the nice thing about the law. It was
Yes, it's cost effective. Yeah.
Yeah, the,
Times two. Sorry, go ahead.
sorry,
Marcia.
the law that was signed for the Bagley-Keene Act allows advisory committees to be completely remote. For board meetings, the rules are a little different, but the committee meetings, which with these two, we usually hold 2 in 1 day, and they're, usually half days, so we can have those online.
Thank you. Thank you so much for the clarification, all of you. Mhm.
Any comments from the audience? How about from our remote participants?
Thank you, Mr. Chair. If any member of the public would like to comment, please raise their hand by either clicking on the hand next to your name or pressing *3 if you've called in. We'll give you a moment. This is the moderator, and Mr. Chair, I see no requests for comment. I return the floor back to you.
All right, thank you, Tricia. Next on our agenda is item number 26, update on board-sponsored and board-monitored legislation. Roseanne?
Thanks. So I am happy to report that we have answers on a lot of the bills that the board had positions on or was watching for this past legislative session. The governor was required to sign all bills that to sign or veto or make a decision on all bills that were on his desk by October 14th. So in terms of the bills that were being tracked by the board, AB 232, which is our temporary practice bill allowance that creates a 30-day temporary practice allowance for out-of-state licensees whose clients are traveling here. I'm happy to report, as I alluded to earlier, that bill was signed by the governor and will be going into effect on January 1st. Also, our omnibus bill, SB 887, we had 2 items in that. That was signed by the governor as well and will be going into effect January 1st. A bill that the board supported, AB 665. That bill makes requirements for a minor to consent to mental health treatment for both Medi-Cal recipients and non-Medi-Cal recipients. It makes the requirements equal. But before, the barrier, the threshold for Medi-Cal recipients was higher than for non-Medi-Cal recipients. So now it will be equal. And so that bill was signed into law, and that will be going into effect. A few bills became 2-year bills. You can see that in your packet. One that was signed, SB 372, the board was in support of. This bill requires DCA licensing boards to update its records, including any records in its online or Breeze system, to include a licensee or registrant's updated legal name and gender and make the former name and gender confidential. When that licensee or registrant provides documentation that their legal name or gender has changed due either to a name change to align their name with their gender identity or a name change due to certain domestic violence situations. So that bill was signed into law, will become effective January 1st, and the board was supportive of that. One bill that the board supported, SB 373, would have required the board and psychology board prohibited the board from disclosing the full address of record of licensees or registrants, and instead only relay the city, state, and zip code. The governor vetoed that bill, and I included a link in your packet to his veto message that explains his reasoning for vetoing that bill. And then a couple of other ones that are of interest. SB 143 So this bill was a cleanup bill that was run at the very end of the legislative session. It was kind of in a gut and amend sort of format, and this conforms state statutes with a recent federal law establishing and enabling the portability of professional licenses for service members and spouses if specific requirements are met. So basically, for service members and spouses, the federal law states that if they have a license, an equivalent license in another state, basically the boards in the other states have to recognize it. So the 143 put in some requirements for that and kind of worked out the details of how that's going to work. So that will be going into effect. It's in effect now, actually. And then SB 525, I know a lot of people were watching that. That's the minimum wage for healthcare workers. That bill was signed with kind of a phased in implementation that raises the healthcare worker minimum wage to $25 an hour. So, and then 544 was the Bagley-Keene Open Meeting Act that modernizes the Bagley-Keene, as we alluded to earlier. That bill was signed by the governor and will be going into effect January 1st. So basically what we're doing is starting January 1st, the Bagley-Keene Act will have those 4 options that DCA mentioned earlier. So that's the legislative update. Are there any questions?
Nick?
I don't have a question, maybe just a comment. I was really pleased to hear that SB 143 went through. I know that the Department of Defense was a big proponent of the Interstate Compact, and I think this is going to be huge for our military service members. I think that's a very important bill. So I just wanted to go on the record to say that.
All right, thank you. Anyone else? Abigail?
When it says this is a 2-year bill, what does that mean?
So a 2-year bill means that the bill did not make it through the required legislative committees this year. So the legislative session runs in 2-year cycles, and this is the first year basically of a 2-year cycle. So they will try, they have the option to try again in January with that same bill if they want to. A lot of times, sometimes a 2-year bill will move, a lot of times 2-year bills don't move. So we just will continue watching those bills to see if they move. Many of them probably will not, maybe 1 or 2 out of the group that you see here will. And so we will continue tracking it if it remains alive by the next meetings.
I was up. Yes, Susan?
Roseanne, I have a question about Bill 372. What exactly, I mean, I know we're not allowed to collect demographic information, but what does that mean about name and gender changes?
So basically, the concern here was that it's if somebody changes their name to conform their name with their gender identity, they may not want their old dead name, the name that they're no longer using, they may not want that to be made public. And right now, when somebody changes their name on the DCA licensing system, so that licensees can look up somebody they might know under an old name, typically the old name remains as a previous name on the system. But that can be problematic for certain individuals that might be targeted by hate groups or by people that are not, trying to do them harm. And so they can request in these specific circumstances that the dead name be made confidential. And so there's a specific process, and DCA worked really hard with this on the author's office to kind of make this process so we could not show the old name, but still have a way for the public to access if there was a disciplinary record that contained the old name. Basically, we had to come up with a process to do that without revealing the old name. So this was a solution that was worked really hard on, and the board was in support of, and I think that it'll be a positive change moving forward.
Thank you.
Abigail?
I'm like raising my hand, looking at her. For SB 373, since that bill was vetoed by the governor, and so licensees and registrants will need to continue sharing their addresses, and that will be posted online.
Yes.
Okay.
So they will have to, that means that we will continue to post an address, including the street online. They do have the option if they do not want, if for some reason they only have a home address to share, they can also have the option of sharing a PO box if that, so that will basically remain in place. The governor did not feel that that was a change that he wanted to make.
And on the applicant, on the application, is it clear that people can have that option? Okay.
Yes, it is. It does say that you can use a PO box in lieu of that.
Okay, great.
Okay. I was also very excited that our omnibus bill went through, as we're now able to expand supervision for MFT trainees to LEPs who are working in schools. I think that's fantastic. Any other comments from Kelly? Oh, sorry, Justin. We'll get
Yeah,
Justin and
I
Kelly
do have
first.
one quick question. Sorry, Justin, go ahead.
No, go ahead, Kelly.
So on 143, Roseanne, that now means that a therapist who's licensed in a different state, if they're, for instance, married or are a service member, can come to California, and if they have the same scope of practice, they're essentially licensed in our state.
They're not actually issued a physical California license, but yes, the law requires us to recognize that they're, like, let's say they're licensed in New York. We are required to recognize that license and permit them to practice here.
Okay.
But we're not issuing.
We're not issuing a actually
Right.
physical California license. It is basically they can apply, it's a recognition.
Right.
Thank you.
All right. Thank you. Justin?
Hi, so thank you for all of the updates. Regarding 525, the minimum wage, am I understanding correctly that covered healthcare services does not include therapy, social work, or clinical counseling if it is outside of a hospital or skilled nursing facility? Is that correct?
So this bill has left a lot of unanswered questions. It was kind of made, there was sort of a deal made at the very end of the session between the union sponsoring it and the stakeholders. And so there are a lot of questions about what exactly is covered that nobody really knows yet. And so the last that I have heard, the stakeholders are talking to the author's office, trying to get some more clarification. There is the possibility that's been floated of running a follow-up clarification bill, but it was kind of a little bit of the way this bill ended up. We kind of thought, and we kind of asked for clarification with the author's office. They didn't end up really clarifying it. So that was a little bit of a surprise. So we're continuing to work to try to get clarification.
Okay, and I know much of that is outside of your ability to address, so thank you. I guess my concern is that the majority of individuals under the purview of the BBS would not know what they are expected to be paid or paying in 6 weeks when this is expected to take effect.
Yes, it actually goes into effect in June. There's a delayed implementation, and the $25 an hour is tiered based on the setting. So there, yes, there is a lot of confusion out there, and we're not getting a lot of answers yet. We're hoping that those will, and it's implementation season, so they're probably working. There's a possibility of, I think it's the Department of Industrial Relations has a certain deadline that they have to come up with a waiver for certain settings. And so I expect we'll be hearing more. I expect that there's a lot behind the scenes that those agencies that are trying to get sorted out. So we will keep you posted if we learn anything soon.
Great, thank you. Just a very brief follow-up. Is keeping you posted the next BBS meeting or in between?
Probably in between.
Great, thank you.
All right. Thank you, Justin. Any other comments? Good. Kelly? Oh, you went? Any? All right. Perfect. Nothing from our audience. Any comments from our remote participants?
Thank you, Mr. Chair. If any member of the public would like to comment, please raise your hand by clicking on the hand next to your name, or if you've called in, pressing *3. We'll give you a moment. All right, we have Kathy Atkins, and Kathy, you should be able to unmute.
Kathy Atkins with CAMPT. Thank you for the legislative update. And I just wanted to second Roseanne's comments about 525 and a real lack of response being provided on how this impacts many, many providers, taking into account this isn't just mental health, but every healthcare provider out there. What we're hearing, is definitely a push for some sort of cleanup. I think Roseanne mentioned the cleanup urgency coming next year, and we're pushing. I know the BBS is working, CAFT, NSAW, all the stakeholders are really pushing for clarity on this bill, given the uncertainty and concern by so many providers. But just reiterating what Roseanne said and clarifying that stakeholders are very invested and concerned. Thank you.
Thank you, Kathy.
All right, this is the moderator. I see no further requests for comment. I return the floor back to you, Mr. Chair.
All right, thank you. Next on our agenda is the update on board rulemaking proposals. Christy, the floor is yours.
Thank you. Okay, so at the August meeting, the board approved 2 regulatory proposals, and I'm going to give you an update on that. So the first one is the disciplinary guidelines, and that is in preparation for the DCA initial review process. That process, along with the rest of the regulation process, is provided on the next few pages of your meeting materials. And then there was a proposal for the unprofessional conduct regulations. This one is, I did prepare all the materials, so it has begun the DCA initial review process, and the last I heard is that the DCA director did sign off on it, and it's now at, and budget signed off on it, and now it's now at the agency level. They have 30 days. It generally takes 30 days, and then if they approve it, it comes back to us, and then we will formally notice that regulation to the public and solicit public feedback. And I'm going to cover actually a little more of that, since I'm not sure any of you have been through a full regulation cycle yet. It'll have a 45-day public comment period. And if we do get comments, staff will draft responses for review by our legal counsel for our regulations. We have a separate legal counsel who you'll see at meetings. I think Christy has been to a couple. And then if we do get our responses to those comments will be brought to the board meeting so that the board can approve the responses that have been drafted or change them or disapprove. And then if we make substantial changes to the text as a result of those comments, there will be another public comment period that's 15 days. It's a bit shortened. Once it goes through that, then it's the final filing phase, which I'll develop and submit the final regulation package to our legal regulations council. If there is a fiscal impact, it'll go through the State Department of Finance for review, which can take some time. And then again, the DCA director and agency will have to sign off on it because there could be changes at that point that they will want to see. And then the final package will be submitted to the Office of Administrative Law, and then they will do a full review. They will often have changes. We may or may not need to bring back. If they're substantive, we will need to bring them back. And then once OAL approves it, if they do approve it, then it will become law as of the effective date that we've specified. And then, of course, we'll work on implementation. So that's the phase. The disciplinary guidelines package is going to take quite a significant, because it's a 50+ page document and we have so many changes to it. It's taken me quite a while to get that prepared to start the process, but I'm working on it as much as possible. So, and that was all I had.
All right, thank you, Chrissy. Any comments? Let's see with glasses on. Any comments from our board? Kelly? All right.
No comments.
Nothing from our audience. How about from our remote participants?
Thank you, Mr. Chair. If any member of the public would like to comment, please raise your hand. We are displaying instructions and we'll give you a moment. All right, this is the moderator. I see no request for comment. I return the floor back to you, Mr. Chair.
All right, thank you, Tricia. And next up on the agenda, item number 28, suggestions for future agenda items. Are there any future agenda item suggestions from our board members? Nick?
Yeah, this is Nick, LPCC member. There's one item I think the board should consider discussing. It has to do with unlicensed student trainees operating in institutions that are not required, specifically social workers and counselors. Being that they are practicing clinically out in the field, unregulated, assuming to be under good supervision with good faith of an institution supporting them, but there's no board oversight of these providers. And I know that's a bigger conversation, but I think it warrants the board to look at this as an issue, especially as it relates to consumer protection. Because as it stands today, the board has no clue, with the exception of MFTs, which are required by law to be supervised and tracked by the board.
All right, thank you. Got that, Steve. Cool. Justin?
I am increasingly concerned, as I think a lot of MFT associates are as they leave graduation, about the rampant exploitation of supervisors. And so I am hoping that in future meetings, the board can look at not just what the scope of our oversight is, but also what some best practices of other boards and other states are, including issues like the extraction of surplus value, how much they are extracting for supervision costs, insurance benefits, deductions from pay. But I think that this is an important issue that we keep sort of kicking the can down the road in different ways when we're talking about supervision, but we haven't directly addressed this exploitation.
Justin, can you clarify? You said exploitation. Is it exploitation of supervisors or by supervisors?
Oh, supervisors are not exploited. Yeah, no, there are the equivalent of diploma mills where they just bring in supervisees,
Okay.
exploiting them, extracting their labor, offering virtually no supervision. Yeah.
That makes sense. Thank you.
Taking it, and just so that you all have a frame of reference, it is not uncommon for supervisors to deduct 50 to 90% of supervisees' pay for every session. That means that you have people with at least one master's degree who are getting $20, $30 per session, while their supervisor is extracting $90 to $100 for seemingly for supervision fees, if they receive that at all.
All right, thank you, Justin. Kelly, any, yes?
And I just like to second Justin's comments, particularly in rural communities where there aren't a great breadth of supervisors here. The problem can become very concerning. But here's my suggestion for a future agenda item. I would like the executive officer to arrange another 10 to 15-minute presentation, but I'd like this presentation to be on the intersection of licensing and racial bias in test-taking systems. I'd like this board staff to identify a proper expert in this area, and my suggestion is to look at the Atlantic articles, or I believe there's a doctor of social work named Widian Nicola, WIDIAN-NICOLA, who does research in this area. And alongside that 10 to 15 to 12-minute presentation, I'd like the board staff to examine what board member Ortega suggested, because she is solution-focused, of alternative pathways to licensure, and specifically Oklahoma and Wisconsin, and also examine what the DC board did with their NASW exam, because the last I heard, DC actually was considering dumping that exam and moving toward alternative pathways to licensure. So I know that's a big ask for the next board meeting, but really it's just two things. One, that 10 to 12-minute presentation, and two, kind of examining alternative pathways to licensure and what some other states are doing alongside what DC did eventually. Thank you.
All right, thank you, Kelly. Any other agenda items? No? Excellent. Ben?
Thank you, Ben Caldwell, MFT, and I apologize if this is redundant. I know it's come up in prior conversation. I just don't know whether it's come up formally as a request for an agenda item, so apologies if it has. For folks who are gaining hours of supervision under the 90-day rule, there is confusion among employers and supervisors about what level of supervision is necessary. And this is particularly relevant for MFTs, but it actually impacts all the professions. Folks don't know whether they're supposed to be applying the supervision ratios from the time someone is a trainee, or whether they're supposed to be applying the levels of supervision typical when someone is an associate, because they're in kind of that in-between stage. So it would be nice to see discussion and possibly policymaking to specify how much supervision is necessary for someone gaining experience under the 90-day rule. Thank you.
All right, thank you, Ben. Are there any future agenda items from our online participants?
Thank you, Mr. Chair. If any member of the public would like to comment, please raise your hand by clicking on the hand icon next to your name, or simply pressing *3 if you've called in. We'll give you a moment. This is the moderator. I see no request for comment at this time. I return the floor back to you, Mr. Chair.
All right, thank you, Tricia. Next is on the agenda is item number 29, public comment for items not on the agenda. I will now open for public comments for items that are not on the agenda. As a reminder, the board may not discuss or take action on any matter raised during this public comment section, except to decide whether to place the matter on the agenda of a future meeting. Each commentator will have 2 minutes. Do any of the board members have any comments for items that are not on the agenda? Kelly? No, excellent. All right. Our audience? Nope. All right. Moderator, how about from our remote participants?
Thank you, Mr. Chair. If any member of the public would like to comment, please raise your hand. We are displaying instructions and we'll give you a moment. All right, this is the moderator and I see no requests for comment at this time. I return the floor back to you, Mr. Chair.
All right, thank you, Tricia. And our final agenda item is adjournment. Thank you so much all for participating today. I hope to see you at our next board meeting that will be held not in November, it will be held in February
29th, March 1st. 29th and
February,
March 1st.
yeah, February 29th and March 1st. And with that, our meeting is adjourned. Everyone have a very happy Thanksgiving.